All right, good morning everyone. Okay, good morning Queensland. So today we have some very important news, so I really would like Queenslanders to listen, because we've gone through things in the past and we get through it by all working together and doing the right thing. So we've had a very extensive briefing this morning, very early this morning, and we now have 3 new cases. 1 is in hotel quarantine and 2 are locally acquired. So there's a case that's linked to the Portuguese restaurant and that person's in home quarantine, so we're not concerned about that. But as was reported yesterday, there is a female minor from the Bli Bli area on the Sunshine Coast, and it is confirmed as positive with the Delta strain. So it is absolutely important, if you are living in around Bli Bli or the Sunshine Coast, that if you have any symptoms whatsoever, we really need you to go and get tested immediately. That is absolutely critical. And Dr. Young will give an update about where this person has been, because we know that this is a highly infectious strain and we really need to get on top of this very, very quickly. And I'll be announcing some restrictions in a moment, because we've got to act quickly and we've got to act fast. So in terms of our active cases, we've got 41 active cases. We've had 6,656 tests done in the past 24 hours. And once again, if you are feeling sick, go and get tested. It is absolutely critical you do that. 5,714 vaccines were delivered yesterday. And our total vaccines from Queensland Health now are 521,731. So the next 24 to 48 hours are going to be very crucial in Queensland about whether or not we see any spread of this Delta strain. So there's a lot of things happening across the nation at the moment, and there's some things that are happening in Queensland. We've got to act very quickly. So what I would like people to do is, officially it's going to come in at 1 a.m. on tomorrow, the 29th of June, but I really want Queenslanders to start wearing these masks again, especially in the southeast region. I want you to start doing it now. So if you are hearing this message, please get it out across all of your channels, talk to your friends. Let's start wearing these masks. This is absolutely vital to help stop the spread. And secondly, vaccines. Go and get your vaccine. If it's your turn to get your vaccine, don't miss that appointment, because you're taking that appointment from someone else. And if you're due for your second vaccine, go and get your second vaccine. Okay, so in relation to the masks, so remember we're going back now to the restrictions we put in place in January, and I'm quite sure people will understand that we have to do this because we need to get on top of it very quickly. So the following LGA areas where you'll be required to wear masks are Noosa, Sunshine Coast, Ipswich, Logan, Redlands, Moreton, Brisbane, Gold Coast, the Scenic Rim, the Lockyer Valley and Somerset. We're also going back to the 1 per 4 square metre rule. Unfortunately, no dancing. Very small numbers at weddings, around 20. You have to be seated to eat and drink, and remember, you've got to wear your mask in there. You must check in. Can I tell everyone, if we're going to get on top of this, you must use that app. If you are going into a cafe or a restaurant or a shopping centre, you must use that check-in app. That is another critical line of defence for us. And then, of course, we are now lowering the number of people to your home, so that'll be 30 people allowed to your home. Now, this mask wearing will be in force for 2 weeks, 2 weeks in those regions. But of course, if we see any further spread of this in other parts of the state, the mask mandate will come into other parts of the state as well. I know this is not ideal for everyone, but we have got to act quickly. And of course, National Cabinet is meeting later on this afternoon, and I think there's a whole number of issues we need to raise. I think our caps need to be lowered for overseas arrivals. I think we need to have a really good conversation about regional quarantine and about quarantine facilities that are not hotels. We have seen leaks out of hotels in a large number of states. It is not unique to Queensland. This has happened in Victoria, it's happened in New South Wales, it's happened in South Australia and Western Australia. So this is a national issue. And of course, the vaccine rollout. The vaccine rollout is imperative. This is the best thing we can do to fight this virus, is to get vaccinated, to get people out of hotel quarantine into regional facilities. And I welcome the Prime Minister's offer for one at the Brisbane airport, but we need the one at the Brisbane airport and we need Wellcamp. We need to get people out of these hotels, and we need to get the Australian population, we need to get all of Queenslanders vaccinated because this is the highly contagious strain, and I know that we can get on top of it if we all act collectively. So look, I'll hand over to Dr. Young to go through those venues. But like I said, there's a lot happening at the moment, there's a lot happening in Queensland, and thank you everyone for doing the right thing, and I know that we can get through this together.
Thank you, Premier. So yes, we have 3 new cases in Queensland overnight, one of them in hotel quarantine acquired overseas. One of them is someone related to that Portuguese restaurant cluster, and they were in quarantine, so they're not a concern. And then the third one is one of those 170 fly-in fly-out miners based here in Queensland. So we are rapidly testing all 170. So far, this particular individual who immediately responded when we texted her, contacted her that she was one of the 170, got tested, and we found she was positive. So thank goodness to her rapid response. She was only out in the community for 1 day. She was with her family and they started a road trip but immediately came back. So there are a few service stations and cafes on that route. So that's all on our website, and we'll put that out in a press release so people can see exactly where those risk places are. But essentially, we don't know where this virus might next pop up. We've got those 170 miners throughout the state that we're working with today and have been over the weekend. We've got those 5 flights that Virgin crew member was positive on. 2 of them flew into Queensland, 1 Gold Coast, 1 Brisbane. Then we've got the flight that the miner came back on, another Virgin flight on Friday night into Brisbane Airport that we're contact tracing. Then we've got all of those people who have been in New South Wales recently and have then come into Queensland, and we've asked to stay at home. So we've got enormous risks throughout our state. But I'm very confident with all our strategies and our mitigating factors that we have in place, and everything that all of us have learnt over the last 18 months, that we can manage this. So please, everyone's getting really good at wearing masks. Please put them back on. That is really critical for those 11 LGAs around the southeast corner. So please start as soon as possible. Don't wait till 1 a.m. when we're bringing it in tomorrow morning. Start now. That's important. Plus, we're going back to 1 per 4 square metres, except for the smaller venues can have that slightly increased number. So we've all done that before. We know how to do that. And we now have that check-in QR code, which is just so invaluable. So really, please make sure you use it. I'm thrilled. Last night at the State of Origin, we had 56,000 people check in there. So all of the people attending and all of the staff. And I think there was some double ups there. People were checking in and then checking into if they were going to other parts of the venue. That was just done so well. So I congratulate Suncorp Stadium on how they've managed that. So we are not going to change that capacity allowed for ticketed and seated events, because I know how well people have been managing their COVID safe plans, so they will continue. So 100% capacity, whereas ticketed and seated, that's indoors or outdoors, otherwise 1 per 4 square metres if people are standing and mingling because of that risk. Also, there will only be 30 people allowed at people's homes, including children, including visitors, including residents in that home, just to reduce that amount of mingling. Weddings and funerals are back at 100 people. Weddings, up to 20 people can dance at any point in time, so that allows the wedding party to dance. Otherwise, there's no dancing, because other venues and so forth, people are seated where they're eating and drinking. So please, everyone, put your masks back on. You don't need to wear them if you're in the car by yourself or only with your household members. You don't need to wear them exercising outdoors if you're only with your household members. But otherwise, it's important you wear them. Of course, you don't need to wear them when you're seated, eating and drinking. But when you get up, please put them on. We know that masks make a difference, and if we can do all of that work, then hopefully we won't have to go into even further restrictions. Thank you.
Thanks, Premier. I too would like to thank everyone at the State of Origin last night who complied with those requests we made late yesterday afternoon. That was great to see lots of people wearing masks to and from the venue and while they moved around, and the stadium staff as well as our TransLink staff did just such a fantastic job, and I want to thank the media for helping us to get those messages out at very short notice late yesterday afternoon. We were responding then and we're responding now because we find ourselves in a very delicate situation. We saw in New South Wales last week just how critical timing of these decisions is, and while we have a low number of cases in Queensland at the moment, we have a high number of risks, and so we need to give our contact tracers time to do their work. Timing is even more important with this Delta variant, and that's why we are acting swiftly here. We have been saying for months and months and months now that hotel quarantine isn't working. Our international borders are supposed to be closed right now, and yet somehow the number of people waiting to come to Australia from around the world hasn't really gone down since Christmas, despite thousands of arrivals each and every week. And I think the federal government needs to be stricter with the exemptions that they are providing to people to come here. Hotel quarantine of international travellers is our single greatest, far and away, our single greatest source of COVID into our country and into our communities. We understand that only around half of those returning to Australia from international locations are Australian permanent residents or citizens. And while clearly there would be some justification for some exemptions, whether that should be thousands per week, putting our community at risk, is a concern. Until the Commonwealth Government can address those concerns, and certainly while we deal with this delicate situation, as the Premier has indicated, we will seek to reduce the number of arrivals into Queensland. That will relieve pressure on our hotel quarantine. It will proportionally reduce the risk of further leaks, and also provide capacity in our hotel quarantine system for Queenslanders returning from other states who may now need to quarantine. But we wouldn't be in this situation, we wouldn't be reducing our number of international arrivals if we had purpose-built facilities which could have been up and running now. We now have two proposals on the table, the address that the Prime Minister provided us last week and the very detailed proposal for Well Camp. Both are about 1,000 beds. I understand currently in hotel quarantine we have about 2,300. So if we were to build both of these facilities, we could substantially reduce our hotel quarantine operation greatly reducing the risk of leaks of COVID out into the community. And so we would urge the Commonwealth to support us to go ahead with the proposal that is already planned and detailed and costed, while we work through with them the details of how we would build a similar facility at their inner urban proposed location.
Thank you. So I remind all Queenslanders, we need to get back into the habit: social distancing, washing your hands or sanitising your hands. Wearing your mask indoors and outdoors will be mandatory from 1 a.m. tomorrow morning across 11 local government areas in southeast Queensland, but as the Premier said, we're encouraging you to wear them now. We know that last year we talked about 15 minutes close contact. Now we are talking a matter of seconds and minutes. Fleeting contact we have seen in New South Wales with this new variant. It is highly contagious and we must take this very seriously. But we know we can do this, we know we can do it together. We want businesses downloading the check-in app now. Although we've said we won't start enforcing it for 2 weeks, we are expecting you to do it now. And especially those big retailers, which I saw some on the weekend, are not using the check-in app yet. It is very easy to register and to put those signs up. We saw it with Suncorp, they did it brilliantly. You can do it very quickly and your customers can have that confidence going in that we will be able to contact them if there is any contact or transmission at those venues. So please check in. Also testing. We want people coming out wherever you live in Queensland, if you have any symptoms whatsoever. We want to see our testing numbers high. So please don't assume you've just got a head cold or a sore throat, or it might be sinus. We want, if you have any symptoms, to go and get tested. This way, if we do all these things that we've done so well over the last 18 months, if we do this and we do this together, we can get through it. Thank you.
Good morning. This is a really good time to remind everyone that as we move back into the restrictions, that our police officers will be out and about making sure that our community does comply with those restrictions. In particular, the mask wearing is going to be a strong focus for us. I echo the sentiments already stated around how well everyone did at Suncorp last night, including wearing masks. We need to see that right across the community for the next 2 weeks. So as always, we will work with our community to make sure that they can comply with those directions. But just remember, there's a $200 fine for failing to wear a mask. And if directed by a police officer to wear one and then still refusing to do one, there's a $1,334 fine that then can be applied. And indeed, of course, at our road borders, which we are still checking people coming into this state, and in fact, 2,683 vehicles were intercepted yesterday and 7 were turned around. There is up to a $4,000 fine that can be applied for people for giving incorrect information there. So we will increase our operational presence, we'll make sure that people do the right thing, and we'll work with our community to make sure that these restrictions keep us safe. Thank you.
Any questions for myself or Dr. Young?
Are we any closer to shutting off or having a hard border?
At the moment, we are monitoring the situation really closely for the next 24 to 48 hours. So if we start seeing any spread of community transmission in New South Wales, especially closer to our border, we will not hesitate to take strong action.
How crucial is it that people follow these new restrictions to avoid snap?
It's absolutely critical. So the mask wearing, making sure you get vaccinated, going and getting tested if you're sick, these are just absolutely crucial. And I'm quite sure that Queenslanders will do that. We've done it before. We've got on top of things before. We can do it again.
Do we know where or how far the woman from Bli Bli had gone on the road trip?
Dr. Young, do you know?
I don't have it with me.
Yeah, we'll get all those details out on all of the media channels and on our social media as well. So if everyone can please listen to the radio, your television, the papers, social media, please make sure that if you've been to any of those venues, it's critical that you take action straight away.
So masks in shops or if you're out and about the streets anywhere?
Yes, indoors and outdoors,
transport.
unless you're seated to eat and drink. Yep, public transport.
In workplaces as well?
Sorry?
You have to wear a mask.
Yes, in workplaces, unless you're in a room by yourself and no one else is there.
What about exercising?
Exercising is the same rules from January. So like Dr. Young said, if you're outside and you're by yourself, you don't need your mask. But if you're with a person that is not from your household, then you will need a mask.
And the rule from January was the end of your mask in your car. Is that
No, you don't need the mask in your car or if you're with...
This sort of feels like that for the future. This is horribly frustrating for everyone.
It's absolutely frustrating for everyone. It is incredibly frustrating for us as well. But this is a world pandemic and anything can happen at any time. So we all have to step up and do the right thing by our community. And unfortunately, as Dr. Young said, there are a lot of things happening simultaneously at the same time. And we hope by taking some of these precautionary measures now, we will avoid having to take tougher action.
This is one step away from lockdown through those 11 LGAs.
It is. We are on the verge, but we are monitoring very, very closely over the next 24, 48 hours. Will we see any further community outbreaks in Queensland? Sorry?
What is the threshold for a lockdown?
When we have unlinked community transmission, this is the Delta strain, and you've seen how quickly it has escalated in New South Wales over a period of about 10 days. So, you know, we're looking at this day by day, and we will not hesitate to take action. I'll tell you that. People know me, they know Dr. Young, they know our team. We will keep Queenslanders safe.
This might be for Dr. Young. Given that this is the first case of the Delta strain in the community, how worried are you about that?
I am concerned, but I'm not particularly concerned about this lady who's been in the Gold Coast, in the Sunshine Coast, I apologise, because she came to us so quickly and got tested. So we just need to work out, and we'll be putting out the exact places she was at, a couple of petrol stations and a few roadside cafes. We'll get that information out there. What I'm more concerned about is the unknown. It's those 169 other miners that we need to get results back on, where they've been. It's those flights that came from Sydney with the crew member who had the Delta variant. It's that flight Friday night. So it's all of those. It's those unknowns. That's why we need to immediately go and put in mask wearing, put in place all of those restrictions and follow this through over the next 24 hours. They've been asked to go into quarantine, yes. That's what we now have to work out. So they've come back from that Tanami mine in central Australia over the last few days. So we have to work out. No. So we have to work all that through.
How far spread are they across the state? Are they predominantly in the southeast?
I don't have all that information yet, but I assume they're throughout the state. Fly in, fly out miners live in their normal homes and then fly in and fly out to the mines.
And you made contact with all 169?
We have sent out an initial message. That's why this lady in the Sunshine Coast came forward.
Some of them are isolated in quarantine at home.
They should all be, yes, all of them.
They're not in hotels.
No.
Did New South Wales wait too late? If you're in the same situation, would you have pulled the trigger earlier?
I'm not in their situation. I'm not there. You have to be in the middle of it. You have to get so much nuanced information to make these decisions. They're very, very difficult decisions to work through, and you need an enormous amount of information. So New South Wales will have been sifting through all of that and making their decisions. I don't know the information they have.
Will you see more police walking the streets of Brisbane after 1 a.m. tomorrow? Or shopping centres or
Lane, I think you can look at exactly what we did in the last couple of times that we had to go to masks in Brisbane in particular, that we'll take that same approach, that we will be checking people for, it's pretty obvious if you're not wearing a mask, isn't it? So we'll be making sure we take action in relation to those sort of people. So the answer is get your masks now. You've got some time to do that. Start wearing them as soon as you've got it, and make sure you wear it when you need to.
Well, you need to wear them if you leave the certain LGAs to another section of the state. Do you carry those restrictions with you when you go?
Yes, that's a very good point, a very sensible point. So if you leave one of those 11 LGAs to go somewhere else in the state, you're bound by the same restrictions. That's a pretty standard process now across the country. And could I just mention something that I didn't mention earlier that's absolutely critical? Vaccination. Please, anyone who is due for their second dose, come forward and get your second dose when you are meant to get it. Pfizer, that's 3 weeks after your first dose, but it can be up to 42 days. That's still fine. AstraZeneca, it is 12 weeks after your first dose, and you need to have both doses to be protected. It's not enough to have one dose, and they need to be the same. So that's really important, and we are then going to be looking at booster doses down the track. So you need to have 2 doses of the same vaccine, and that is absolutely critical. Can I say to everyone in the state, if you've had 1 dose, go out and get your 2nd dose. Otherwise, you are not protecting yourself as fully as you could be protected. Then for first doses, it is really important. If you are 40 through to 59, or you are 1A or 1B, please come and get Pfizer. If you haven't already had an AstraZeneca, of course, come and get your first dose of Pfizer. If you are 60 years plus, make a booking, or if you've got a booking already, keep it with your GP or with one of the Commonwealth clinics and get AstraZeneca. This is what we can all do to protect ourselves, because we are getting more and more very reassuring data from across the world that people who are vaccinated, they still can get sick, usually don't have symptoms, which makes it a bit hard picking it up, but that's a good thing, and very rarely end up in hospital, and it's even rarer that they die. So getting vaccinated protects you from dying from this virus.
But the lockdown we had in January, it was 1 case in the community of the UK variant. This Delta variant is more contagious. Why are we having a less intense response?
Because people have learnt what to do, and we have so many more things in place. So we have the check-in app. So it is vital that everyone checks in wherever they go. And please, I ask businesses, I know you won't get fined for 2 weeks, but I'm sure you don't do things because you're going to get a $4,000 fine. I'm sure you're doing things because it's the right thing to do for the community. So any business that has not put that check-in app in place, please do it today. It is critical. That is what will help us. And then I'm very, very hopeful that we won't have to lock down. We may, of course we may, but we have got so much more that we can do now compared to January. So we've got the check-in app. We've got masks. I still cannot believe in January how quickly people responded with masks. And even today, I've got people here in this room before we made the announcement wearing masks. So if everyone could wear masks, if everyone could just maintain that social distance and be prepared, as you have been, to come and get tested with the slightest sniffle or symptom. That's critical. So if we do all of those things, that's why we're not having to go straight to a lockdown. We've been doing this for 18 months now, and people and businesses know what they're doing.
I'm just a little confused. The miner from Bendigo who went into Noosa and on to the exit, why was he put in the Noosa in a quarantine hotel if he's only here for a few hours?
Because that's what we've done. So anyone who's come from a hotspot,
The Bendigo wasn't a hotspot.
yeah, the whole of Victoria was a hotspot, yes. So he came from a hotspot and then needed to go into hotel quarantine. We do let people fly on. We don't keep people for 14 days before they fly on. So we've done that with all our international aircrew. They come in, they go into a hotel, then they can leave again. Maritime workers, people flying through Queensland who've got a reason to go on to somewhere else. So we've allowed that, right.
In hindsight, should be kept for 14 days in the fact that he's gone to this mine and possibly infected money.
Well, that's a decision for the mine to have made. So the mines have processes in place for people who come into their mines to keep people safe. So here in Queensland, I've worked right from the start with the resources industry about their processes. So that's something that the mine, but once they knew, because remember, we then contacted everyone who'd been on that floor. And so that's why that miner got tested, because he was contacted through that process.
Why do we put domestic and international people inside the same quarantine?
We don't.
States are saying they don't do that for us.
We don't usually, but we've been under a lot of pressure in our hotels. We've just had so many continuing people from overseas, and then we've had these domestic incidents. So it's just the pressure that's led to this having to happen.
Just with the weight limit, is it 100 people can attend but only 30 can dance?
20 can dance at any point in time on the dance floor, maintaining that, 1 per 4 square metre. So we're just going back to where we've gone in the past. So people know how to do this, and the wedding industry have been fantastic all the way along. They know how to implement this.
The 169 miners, do they all come up at the same time?
No. They'll have come back over a period. So that's all being worked through.
For people that have left South East Queensland to other parts of the state, when are those restrictions backdated to?
1 a.m. tomorrow morning.
Okay, so if you leave and left Brisbane to go somewhere else, you're going to have to wear a mask.
Yep.
Premier, the situation seems to be, rapidly growing across the country. Would you like to see a better, I guess, a national approach to this situation that we're seeing at the moment?
I think National Cabinet works well when everyone comes together and goes through the different issues. But what we're seeing, unfortunately, Jack, is a lot of issues happening at once. So I know the Chief Health Officers are meeting and they're concerned, and I'm quite sure that all of the other Premiers and First Ministers are just as concerned. Okay, so I thank everyone for please doing the right thing, and we'll be keeping everyone updated every day during this. But please stay safe, wear your mask, very crucial, get your vaccine.
Thanks, everyone.
Mask, exactly, just make sure